In this video, I'm going to show you real life footage of someone in the actively dying phase. I think it is important that people see what actively dying, which is the last phase of life, really looks like. TV and movies have really done us a disservice by showing people giving a long, beautiful monologue, then slowly just closing their eyes and fading off to death. And that is not how it happens. Those of you who have witnessed this firsthand will agree with me that is not what it looks like. And if you aren't prepared, it can feel really scary. And what I want to do is take the fear out of it by showing you it and explaining what you're seeing. That way, when you are in this moment with your loved one, you can be present, make this moment, dare I say, a little more sacred instead of scary. One more disclaimer, this is not my patient. This is given to me by a follower of mine. I have written and verbal permission from the family to show these videos. This is purely education to help you. Before each video, I'm going to give you a trigger warning, a little explanation, and then after you watch the video, I'll come back and explain a little more about what you were seeing. So in this first video, you're going to be seeing a woman sitting up in bed, fully unconscious. I want you to listen to how her breath sounds. So you will be hearing terminal secretions or the death rattle. You'll be seeing changes in her breathing. You'll see how her mouth is gaping open and how her family is keeping her lips moist with a sponge. Perfect. It's perfect. So trigger warning, here is the video. That is the first video I'm going to show you. It's a great example of how someone looks when they're actively dying. You can see she is fully unconscious. Her mouth is open like that because the muscles it takes to close your mouth and hold it shut are relaxed. So people's mouths at the end of life will almost always be open. Her eyes are closed. You can't tell because they're blurred, but her eyes are closed, but sometimes even their eyes will be open, but they're not really there. It's also very normal for that to happen, and that's also because of muscles relaxing. Her family is keeping her comfortable. I love seeing this part because they're using that sponge, which usually has some kind of cold water or juice or something on it, to moisten the mouth. You can even put it inside your loved one's mouth to moisten their tongue. Just keep everything moist in there. They don't need to swallow it or drink it. It's just a matter of keeping everything moist. Now, what was that gurgling noise? That's the worst part. People hate it. It's called the death rattle, which I think is an awful name, but that's what we're working with. And it sounds worse than it is. At the end of life, your body is still creating moisture to keep your mouth moist. Just like you and I, it's happening to us unconsciously right now, and we will unconsciously swallow that saliva. I just did it right now. At the end of life, the saliva is being created, but the body is no longer telling itself to swallow. So it's just sitting there on the back of their tongue, and with each breath going over that saliva and their mouth being open, it's creating a gurgling noise. People really don't like it. They think their loved one's drowning on fluids. That is not happening. Some people's death rattle will be worse than others. It just depends. There are many things you can do to help with that. One, you can just let it be because it's okay. Two, you can sit them up like they sat her up. You can use sponges to try to get rid of it if you want. You can turn your loved one on their side to help it come out of their mouth. You can give medications to help dry up those secretions. All of this can be offered to you by your hospice company as well. You guys know I love the Macy Catheter. So today with the Macy Catheter, what I want to talk to you about is sublingual medications and when the Macy Catheter will be helpful. So a lot of patients on hospice will be getting sublingual medication, which means bits of medication placed under their tongue or near their gums so that medication can be absorbed in their mouth, which is very effective most of the time. Sometimes what happens is when someone needs too much sublingual medication, it takes too long to be absorbed, so a lot of sublingual medication can be stuck in that person's mouth. Plus, add on the terminal secretions, the medication can almost make that worse. So in this case, the Macy catheter would be a great alternative. So for those of you who don't know, the Macy catheter is placed rectally, and then this part of the catheter is placed on the thigh where you can give medications to your loved one or the nurse can give medications through here. And you know I'm a big fan of rectal medications. People always are turned off or taken back by the rectal administration of medications, but truly the rectum is super vascular and it absorbs medications really easily, really well, and it's super effective. So a lot of people would associate this with less dignity, but really once it's placed, this is where the port lies on the thigh, and you can give medication so easily and it's so effective, and you don't have to worry about too much sublingual medication not being absorbed in your loved one's mouth. So a great example of when to use this is when someone's having a lot of pain or a lot of agitation and the sublingual medication is just too much or not cutting it. The Macy catheter is a great alternative to give medications like that, one for effectiveness and two to avoid all of that sublingual medication not getting absorbed. To learn more about the Macy catheter, visit the link in the description. This next video is of the same woman. I like to show this video because it shows a clear distinction between regular breathing and end-of-life breathing. So the way she is breathing may scare you if you're not familiar with it, and you may think your loved one is suffering because they're breathing different. But the end-of-life breathing is something that will happen with everybody. And this is because there's metabolic changes going on in your body, which is causing your body to breathe different. Your loved one is fully unconscious and not experiencing any suffering because of it. If anything, your body is preparing itself and helping itself do this and shut down. How do we know they are not being disturbed by this? We can tell by how they look in bed. Once you see this video, you'll see how relaxed she looks during these changes in breathing. If she was not relaxed, her body would physically show us by moving, being restless, throwing itself up in bed. It would show us that they were not comfortable. You'll also hear a little bit of like rhythmic moaning. That can happen sometimes at the end of life, and we know they're not really in pain because it's rhythmic. It's almost like a self-soothing mechanism that some people do at the end of life. Now, if it continued for a long time, I might give medication just to be sure, but generally speaking, when it's rhythmic like that, it's usually a self-soothing mechanism. So trigger warning, here is the video. So in that video, you see, like I said, the changes in breathing. You see that she pauses a bit before she takes her next breath at times. You see that she has that rhythmic moaning like I was talking about. A lot of that is a self-soothing mechanism that the body does to help soothe ourselves. And I'm basically showing you this just so you can see the different ways someone might be breathing and how it's all very normal. Now this last video is showing her very last phases of life. This last breath that you're going to see is called agonal breathing. Agonal breathing is not a true breath. It's a reflex that all of us have, and if you're dying a natural death, which people do on hospice, you're dying from something, but you're naturally allowing the body to shut down on its own. Everyone will breathe like this, and it's a reflex, and it's kind of like the last kind of breaths your body will take, and they're probably not really actually getting any air. It's just a reflex, and it can look like, people will call it guppy breathing. When someone doesn't know what's going on, they'll say they were gasping for air. That is not what is happening. You can clearly see this woman is very, very comfortable, and she's just experiencing agonal breathing. Again, a very biological, normal, and expected part of end of life. So trigger warning, here is that video. Okay, so that is agonal breathing, a perfect example of what agonal breathing looks like. Again, none of these videos are meant to be, nor do I think they are, disturbing. People think things like this can look disturbing because they're not used to seeing it. We are shielded from the most natural part of life, and that is death. Showing these videos, helping explain what you're seeing, can help you understand that this is not something that needs to be hidden. In fact, we need to bring it into existence, show people what death and dying looks like so you can have a better experience. Losing someone is already sad enough. Then creating chaos around it because you don't understand and fear can cause traumatic moments that really don't have to be. So learning about it, educating you about it, helping you see and understand what end of life looks like can really create a different scenario for you at your loved one's end of life. Watching these videos helps us understand what could occur and what end of life truly looks like. And being prepared will always help us live better and die better.